I'm Jan Lawrence. I am a Breast Nurse Navigator at Sarah Cannon Cancer Institute. I have been in oncology for 2.5 years. I have been a nurse for a little over 4. I reinvented myself as a registered nurse after having worked in another profession for many years and then being a stay-at-home mom. I thought about the things that I did well. If I have a chance to redo career-wise something, what would I want to be? Nursing just kept popping into my head, and so I went back to school and got a nursing degree and started working with women, and then wanted to specialize in a certain type of care, and so I came here to Henrico Doctors to work in oncology, surgical oncology. Patients are in the hospital for whatever reason after having had infusion or surgery. It is a stressful time in their lives. For nursing to be attentive to what their needs are, to make sure that they are heard and listened and cared for, to make sure that if they have come back due to some complications, I love that. In oncology, you get to see your patients ongoing. I do remember them. I remember what they like, what they don't like. That's also very important. So that when they are here, not in their home, but here in the hospital, they are getting the care that they would receive if they were at home. I think as far as listening skills from my previous profession, and then as far as nursing, you marry those two together, and it does help you with your patient-centered care. And looking at the entire spectrum, communication is so important. Education is so important. As a nurse navigator, you get to help these people along this crazy path of cancer, from diagnosis to cure. They don't know what's going on, so I'm here to help prepare them for it. I have numerous patients that are near and dear, and I really like it when I get to see them outside of the hospital. I have a daughter who is a junior in high school, and a patient that I had cared for in the hospital was there for much longer than he wanted to be. He has a son who goes to the same high school that my daughter goes to, and it was perhaps about a year later that we were both at an assembly recognizing our children that I was able to go up to him. He remembered me, but of course I remembered him. And it was just lovely to see him and that other function of our lives, just being proud parents out and about in our community. I think that what's most important to me is that in oncology, I have a personal history of my family having had, not only my mother had breast cancer, but my brother had brain cancer. And they didn't have someone like me to help navigate through the system. So when I talk to my patients, I talk to them like a nurse. I talk to them as a sister or a daughter who also understands what's going on here, so that I can help prepare them as they're, again, going through this journey of cancer. I've seen it from all sides, I feel, and not personally, but still I've seen it from many sides that really make an impact for the patient and also their concern for their family.